Hello and Assalamu alaikum. Ultrascan diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is the upper maxilla. Let's start focusing on the maxilla. Let's starting with the upper right sixth region. Now you can very clearly see on the OPG right here that we've got an edentulous area in the upper right 6 and 7 region. The upper right 6, when we look at it from a transaxial view, you will be able to notice we've got a ridge width of 10 millimeters and a height of 5 millimeters, very D1 quality bone. But as we move distally, you will be able to notice that in the region of the 7, we've got a oroantral communication. You've got a socket with perforation of the floor of the sinus, 12 millimeters of ridge width, but absolutely no bone. We also can see that there is a radiolucency that is associated with the sinus, and you can see this communication, which is a posterior artery supplying this particular infective area. Now, until and unless this area is grafted and cleaned out, implant placement here is going to be a challenge. The upper left 5 region, we've got a grossly carious tooth. If this tooth is extracted, we've got 9 millimeters of ridge width with approximately 7 millimeters of height. No periapical pathology can be observed, but we can also see close to the apex, it is beyond the buccal cortical plate, and you can see it right here. Now, moving to the upper left 6 region, we can see 3 BDRs present here. If this tooth, these roots are extracted, we've got a ridge width of 10 millimeters and a height of 4.5 millimeters. No sinus communication can be seen. And in the region of the 7, we definitely see that we got no bone height and we have limited bone present beyond the roots. 12 millimeters of ridge width, but only approximately a millimeter of height. No sinusitis can be seen, but we can see that the bone beyond the roots is extremely porous and communicating, almost communicating with the floor of the sinus right here. Thank you very much.